Are you tired of suffering with chronic pain in your feet, chronic numbness, chronic burning, chronic cold feet, chronic pins and needles or ants crawling on your feet? Are you tired of worried about your balance? You're worried about walking. You're worried about whether or not you can watch your kid's soccer game or your grandkid's soccer game. How far do I have to walk from the car? Well, guess what? Imagine feeling refreshed. Imagine having better pain. Imagine that you're able to take care of yourself, have better balance, better walking. You're able to stay independent. Well, that's what this video is about. I'm going to show you a game-changing tool for the majority of people with chronic neuropathy. This tool is going to allow you to feel refreshed, take off the pressure off the nerves, and allow your feet to heal themselves. So stay tuned to the end. We're going to cover in detail. Now, peripheral neuropathy has multiple causes, okay? Probably over 100. However, we can categorize them in structural factors like compressed nerves of the spine, metabolic factors like poor nutrition or diabetes, and there's also neurological factors where we want to rebuild these chronic nerve pathways. But today's focus is on the compressed nerves, the structural factors, or if we look at nerve impingement, even though there's over 100 causes, when you have nerve impingement in the spine, it makes every other cause worse. So in a short answer, when we compress these nerves in the spine, it impinges them. It interferes with the messages between the brain and the feet. And that could either lead to too much signal, in other words, hypersensitivity. That's the majority. You can't even walk. You have to have very padded shoes. Or you have dead nerves where your feet, you don't feel anything. You step on a tack, you don't feel it. Well, guess what? Each of those conditions has a compression effect or a mechanical effect, and we're going to talk about non-surgical spinal decompression today. And like I said, it's going to be a game changer for the majority of you people. So hold on to the end. We'll demonstrate what spinal decompression looks like. And by the way, it's so comfortable. Most of the patients, and myself, I also have neuropathy. Most of the patients that are on the decompression table actually fall asleep on it. I'm Dr. Gregory Kramer. I'm a Livonia-based chiropractor. I'm here in Livonia, Michigan. I've been in practice for over 30 years, in 1989. I specialize in taking care of people with chronic health problems, like chronic peripheral neuropathy, chronic L4, L5 disc problems, chronic knee problems, chronic feet problems. In fact, I really specialize in taking care of problems that affect your ability to walk. Also, I've had all of the problems I've talked about. I've had disc problems, I've had knee problems, I've had foot problems, and I currently have neuropathy. It's about 90% better. However, our multimodal approach, multimodal means we use a variety of treatment methods. Basically, we address all health problems structurally, neurologically, and metabolically. Structural, we're looking at physical compression on the nerves. Metabolically, we're looking at nutrition. We want to lower inflammation and help the body heal itself. Neurologically, we want to rebuild these nerve pathways from the brain to the feet so the body can function and heal. So the method provides a high degree of success. We also belong to a group of doctors throughout the United States that have over a 95% success rate. So when patients work with me, you're not just working with me alone. I consult with other physicians throughout the United States that also work with neuropathy using our three-point method of structural, metabolic, and neurological approach. And our whole goal is to get you out of pain, stabilize your body, avoid surgery, whether it's your foot surgery or spine surgery, so you can live stronger, longer, and go back to doing the things you want to do. And typically, people with neuropathy, you want to be able to you want to walk, you want to travel, you want to have better balance, and you want to stay independent in your home. And I get that. And our goal is to help you achieve that. So if this information resonates with you, do me a favor. Like, subscribe, and share it with someone. You know what to do. Like, subscribe, and share it with someone. Every week, I typically put a new video to help your body heal itself so you can live stronger and longer. So today we're going to talk about how does a spinal problem affect neuropathy? Well, like I said earlier, there's over 100 causes, but again, there's structural, metabolic, and neurological factors. This is an MRI. This is the side view of the spine. Spinal cord, vertebrae, disc. This is a large herniation. I'm pointing at it. That's an L4, L5 disc herniation. As you can see, it's compressing the nerve. This is a smaller L5, S1 disc herniation. Well, that interferes with the messages from the spinal cord getting to your feet. Think of your spine like a fuse box. And when you blow a fuse in your house, it depends which wire goes to a different part of the house. So again, you blow a fuse, your refrigerator doesn't work. Well, what if you blow a fuse to the garage door? That doesn't work. Same thing. So spinal compression or nerve impingement is a factor in many people with neuropathy. Now, here's the interesting thing. Some of you don't even know you have spinal compression. But yet, most of you have worked hard over a lifetime, and the last two vertebrae in your spine carry most of the load. So we injure our spine either with a trauma, too much lifting, or just too much sitting. So a lot of people with desk jobs have a lot of spinal compression, but because it comes on so slowly, you don't notice it. And again, that spinal compression affects the nerve. You can see this flashing yellow light. This is a healthy nerve. That's an impinged or compressed nerve. Healthy nerve, compressed nerve. So what we're going to show you now is where do those nerves go, okay? So those nerves in your low back go down your legs. And again, when we see that we compress these nerves, you could feel it just in your feet, making very hypersensitive feet. And I remember 30 years ago when I first started in practice, I had a woman that had horrible feet, horrible neuropathy. In fact, she only could wear sandals in the winter. Her feet were so sensitive. And back then, I didn't know of all the factors. I only knew of one factor. Okay, I knew of the structural component. But as we decompressed the lower back, her feet got better. Now remember, we do a multimodal approach. We look at everything. We look at structural factors. We look at neurologic factors, and we also look at metabolic. Metabolic would be like your diet, like your blood sugar. They all play a role, but today's video is talking about how a compressed low back nerve can cause neuropathy. And it's a game changer for those of you with neuropathy that have not been classified. Again, decompression is not for everybody, but it's for people that have a compressed nerve. And there's some simple tests that you can do. An x-ray will show if there's a compressed nerve, an MRI will show that, and there's some simple examinations tests. So if you have a compressed nerve with or without, I want you to hear this, with or without back pain, spinal decompression would be a great asset for you. So you should find a doctor in your area that can test you to see, are you a candidate for spinal decompression? This is non-surgical spinal decompression. This is our secret weapon for people with peripheral neuropathy. Remember how we've talked about in the past that peripheral neuropathy has multiple causes, and one of the major causes is compressed nerves in the lower back. Well, guess what? If those nerves are compressed, that's going to lead to pain, burning, numbness, irritation, some type of interference. So remember, we want to address the root cause of neuropathy, and spinal decompression addresses one of the major ones. This is a simple table, and you can lie face up, face down on your side, whatever's the most comfortable. We have a type of spinal decompression that's very versatile. This is commonly used for people that suffer with L4, L5 disc herniation or disc bulge or disc degeneration. So this is fantastic for not only neuropathy in the feet, but if we travel the nerve, if we find the nerve, just kind of follow the nerve all the way up to the spine. Think of the spine as a fuse box. When these nerves are compressed in the low back, it irritates, and you can have horrible burning, numbness, loss of sensation, coldness, all the signs of neuropathy of the feet. But you can have leg pain, you can have buttocks pain, and you can have back pain. It's non-surgical spinal decompression addresses it. It's very comfortable. People fall asleep. I used it today on myself. It is a great tool to address people with neuropathy. Again, neuropathy would be burning, numbness, pain, cold, and sometimes alternating numbness, burning, and cold all at the same time. I'll give you an example. You know what it's like. If you're watching this video, you've got neuropathy. So you got painful feet. You know what it's like first thing in the morning. That first step is usually terrible. Imagine your feet being so bad that you need to have cushions on your feet in the morning. Well, guess what? We've had patients that were so bad that could barely walk in the morning that they recovered so much they can start running. Yes, running. We're talking about people, adults, not kids, that have had neuropathy where they went from severe pain, could barely walk, and now are running. Imagine that pressure on the nerves. And again is, when we decompress the lower back, we are taking pressure off the nerves, allowing the brain to reach the feet. We're allowing those messages so the body can heal itself. So spinal decompression is fantastic for neuropathy. It feels great. It is also great for disc herniations and leg pain. Let me show you what it actually does up close. Now, this is a model of a disc. These are nerve roots right here. These nerves are an extension of the spinal cord. This is the spinal cord. From the side view, we have spine, we have the disc, and these are the nerve roots. This is on the right and the left. Well, when you injure the disc, so too much sitting, injuries, traumas, see this red line right here? That is a tear in the disc, what they call an annular tear. Well, over time, you can start getting a bulge, as you see here, a bulge or a herniation that can irritate the nerve, causing neuropathy symptoms. What we're doing is decompression. We're decompressing that disc to allow the protruded bulge, we want to suck that back in, getting pressure off. Decompression pulls and releases, pulls and releases. It's much different than traction, and it creates a pumping mechanism, pumping nutrients and blood in the disc for healing, getting waste products out. So a pumping mechanism, which is different than like someone who hangs upside down. Hanging upside down is just static traction. Decompression is a pumping. Again, we see that bulge, that herniation, and we want to decompress that. Herniation, decompress. And that method of pumping and compressing pumps fluid in and get bad products out. So again, if you have neuropathy, this is a great tool for you. So I hope you liked this video. If you're suffering with neuropathy, it would be very, very wise to seek out a competent doctor in your area that knows how to test you to see if you're a candidate for spinal decompression, which is non-surgical spinal decompression to decompress the lumbar nerves so you have a better communication between the brain and your feet. It could be a game changer for those of you suffering with neuropathy, eliminating the pain, the numbness, the burning, that cold feeling, having your feet literally come alive. So again, find a qualified doctor in your area and see if you're a candidate for spinal decompression. Also, I want to hear from you. Those of you with neuropathy, what have you done? What has been your success? What has been your failure? If you've had spinal decompression, what type of decompression? Were you lying face down, on your side, face up? Remember, there's multiple tables. Not all tables have the variety of positions, and every patient is unique, and some do better on their side, some do better face up, some do better face down. Again, a good qualified decompression expert will be able to position you and find the right position that's comfortable and best for your type of condition. So again, let me know what's going on. Let me know. I want to hear from you. And if you like this information, like it and share it. Subscribe to my channel. Every week we have some information to help you live stronger longer, stabilize your body, avoid surgery to both your spine and your feet so you can live stronger longer, doing all the things you want to do. And particularly if you have neuropathy, I know you want to walk better, I want you better balance, you got to work, you got to sleep, and you want to stay independent. I completely get that. So, and I've had neuropathy, and my neuropathy is doing about 90% better. So again, like and subscribe, follow me on my channel, and let me know what's going on. And your next video you should watch is the 3-step approach, how I look at peripheral neuropathy, and go to that video now. It's right here.